Now live, Chair.
Thank you very much. Good evening, everybody, and welcome to the Health and Wellbeing Board. My name is Councillor Tobin Byers. I'm the Cabinet Member for Adult Social Care, Health and the Environment and Chair of the Board. And I want to say thank you to everyone for making the time to be here. I know a lot of you are awfully busy at the moment, but I think it is important that we get together to reflect on where we've been for the past couple of months and where we're coming in the months ahead. We are going to try and keep this to an hour, so please do keep your contributions as concise as you are able to, and I'm looking at Dagmar particularly when I say that. Are there any apologies for absence? In fact, I think I've got Dr. Doug Hing and Dr. Andrew Otley. Not aware of any others. No. Are there any declarations of pecuniary interest? No. The minutes of the last meeting we held back on the 28th of January have been circulated. Are those minutes agreed? I shall take nodding as assent. Thank you very much. Before we go into the main body, there are a couple of things I just wanted to say at the outset. So firstly, I think we should note as a Health and Wellbeing Board our thanks to everyone who's been involved in the response to COVID, particularly in the health and care sector, but those working in the voluntary services and in our schools as well. And that feels entirely inadequate, and I'm sure there'll be an opportunity to thank them properly in due course, but I do think we should note our thanks this evening. There have been a few changes to the board since the last meeting, so I suggest those speaking this evening maybe introduce themselves and their title when they speak for the first time for the benefit of our new colleagues. So on the council side, Councillor Kelly Braund has stepped down as Cabinet Member for Children's Services, and we welcome this evening Councillor Eleanor Stringer, who was already Cabinet Member for Schools and has now taken on the dual role. So she is very welcome, and I hope we can note our thanks to Councillor Braun for her work over the past couple of years. We welcome this evening Dr. Mohan Sekaram, who's the Clinical Lead for Social Prescribing, and Dr. Adita Shah, who's the Clinical Lead for Planned Care. And there have been some changes within the NHS structures, which James Blythe will outline shortly. And I'd like to particularly welcome Dr. Karen Worthington, who's the new Vice Chair of the Merton Borough Committee, and Dr. Vasa Nanapragasan, who's the new Chair of the Merton Borough Committee. And they are very welcome for this first meeting in their new roles. Those of you who've been on the board for a while will know that Karen served on the board previously, I think for a year or two. And you might also recall that Vasa was one of the GPs who came to talk to us about diabetes a couple of years ago, which ultimately led to the board's work on the Diabetes Truth programme, and clearly very relevant in some of the problems that we will be discussing later this evening. Finally, I just wanted to note my thanks to Dr. Andrew Murray, who stepped down as the chair for Merton CCG earlier this year to take up a new role as chair of the South West London CCG, and I'm sure James will explain what that means a little bit shortly. Andrew was the longest serving member of the board, and I think along with Dagmar has done more than anyone to get us to the position that we are in today. His commitment to place-based and integrated working was second to none. So I do want us to thank him for that. I want us to note our thanks to him this evening. We had hoped to have a proper send-off for Andrew back in March. Unfortunately, that meeting had to be cancelled, but I hope we'll be able to invite him to a future Health and Wellbeing Board just to express our thanks for everything he's done over the past few years. Moving on to the agenda then, we'll move to agenda item 4, and I'll go to James Blythe.
Thank you, Chair. So I'm just going to provide a quick update since the last Health and Wellbeing Board on some changes that have taken place within the NHS architecture. So as the board was appraised, the 6 South West London CCGs had approvals required to merge and become South West London CCG, and this took place on the 1st of April 2020. As scheduled. So Merton CCG ceased to exist as an organisation. We have a Merton Borough Committee, which is chaired by Vasa, and the Deputy Chair is Karen, who's here today, and the other voting members are the locality leads, who are represented by Aditi Shah and Mohan Sekar and myself. So, and the constitution and structure of the CCG in normal operation is that the budget that previously was Merton CCGs is delegated in full to the Merton Borough Committee, clearly working with South West London colleagues where we need to on a number of areas, but with the principle being of delegation of budgets back down to individual borough committees, which are led by local GPs. Clearly, this is an unusual time for this to happen because of everything that's happened with COVID, and there are specific legal provisions that have come into place in terms of the Coronavirus Act that means that we're not quite working in the way that we anticipated from the 1st of April. But we very much anticipate returning to our intended way of working as soon as possible, and the Borough Committee and our clinical and managerial leaders at a local level have continued to play an instrumental role in the response to the pandemic, which we'll come on to a little bit later. On the same date, on the 1st of April, South West London Sustainability and Transformation Partnership, so that's the partnership of all of the health and care organisations across South West London, was granted Integrated Care System or ICS status. Now, what this really means is that the NHS regionally and nationally has confidence in our partnership arrangements at South West London level, and again, in normal operation, has a level of confidence such that they are comfortable for us moving to a position where we take more accountability across South West London for the quality and the performance and the efficiency of our services, and for delivering financial balance across the system, working across health and care partners. Once again, the operation of this as intended is somewhat affected by COVID, but it is again a marker, I think, of our close collaboration, particularly across health and local government, and working across organisations at South West London level. So I thought it would be helpful just to note those changes to the Health and Wellbeing Board, and that explains the slight change in our arrangements and the slightly different cast here today.
Thank you very much, James. And I suppose ultimately what's happening at the moment just reaffirms the need for that integrated place-based work between health and care. That's going to be more important than ever. And I know that we do need to look at updating the terms of reference of the board to reflect those changes, which we will do at a later meeting. Can I move then to item 5, which is COVID-19 pandemic and planned health and wellbeing engagement programme on the impact of vulnerable communities? And I will pass to Dagmar.
Hi, good afternoon. Can you all hear me? Yeah, okay. So I wanted to share a little bit of our initial analysis and understanding of the COVID impact in Merton. And obviously, as a Health and Wellbeing Board, we have, I think, a duty to understand what, first of all, the direct COVID impact was. What I mean is in terms of infections and death, and then in particular with the focus on what were some inequalities in COVID impact, and what does that mean for our future work in terms of protection as well as some longer term work. So if we move on to the slides, you have quite a lot of slides there, and I won't hog all the time. So I will just pick out a few really important indicators. What I need to say is that the data are evolving. And so it is very tempting to jump on conclusions, and I would caveat against that. We are in the process of continuously updating, and so it is descriptive at the moment. Some of the data, it's all referenced to you, is only modeled, where we haven't got the direct data, just using different data sets and lay them on top of each other. So it's our first attempt to make some sense. So if we move on, Clarissa, please. So that, no, that one. So that's a important, no, can you go back? Clarissa, I need the number of cases. So this is an important slide. It shows positive cases, and what you can see is the shape of the epidemic, like a curve, and the good news that very few new infections at the moment. One warning is that the total number of infections is only representative of those who tested positive, and as you will remember, only few very sick people in hospital got tests. So it has to be taken with a pinch of salt. It isn't the whole picture. It also shows us as a rank within other local authorities. So if you move on, Clarissa, for me, can you move, please? We skip that one, and if you move. So this is probably one of the slides that is most important at the moment. It is the most, in a way, distressing. It does chart in the additional or excess death that we had. Again, you will see it is a wave shape. So in the middle of April, we had our peak excess death. And it's important, these are COVID deaths. And what you will spot is that we've put the COVID death in one color and then the non-COVID death in another color. And you will spot that both deaths have had a peak in the middle of April. And that obviously makes us wonder what that is. Partially, the explanation is likely that the reporting of COVID was underreported. But there might also be the sobering finding that we have increases of other deaths. And that is something that we need to unpack a bit more. You will also see an important line is the blue line that meanders through the slide. That shows you the death at the same time last year. And in a way, the encouraging news now is that our total deaths are lower than at the same time last year. That is not too unexpected, because a number of frail people have unfortunately died. So that is in probably one of the most important slides for us to look at. If you then move on, we want to now understand a little bit who were these people, where did they die? Clarissa, if you move us on, that is a slide that shows you that in Merton, as elsewhere, most of our deaths happened in hospital. The second most common place is care homes, but I am actually glad to say that we are not standing out as an outlier with increased in death in care homes. Of course, we had a number, but that is like the London average. If you move us on, Clarissa. If you move us on, Clarissa, please. We skipped that one. It's for your leisure. These are modelled attempts to see who was impacted. This is an important slide for Merton. On the left-hand side, we've tried to plot in rates of COVID death between the west of the borough and the east of the borough. And we had a particular big differential in the first lot of COVID death data we became available from ONS. I'm more relieved that that quite crass differential is evening out a bit, but there is still a difference with more COVID death in the east of the borough, and that is COVID death rates. So we have to have a very good eye on that, and I show you some other slides to try to understand what is the driver for that. If you go to the next slide. I wanted you to be aware and have a bit of a summary of what we already know, what drives disparities in COVID mortality, and there are factors that we have got good and increasing evidence. Age is the biggest predictor. Sex is also universally males are more affected. And then, disturbingly, and it has had a lot of press, rightly so, is that people from BAME communities have, I think, unequivocally more infections, more admissions, and more deaths. And various reports give you the increase. So what is very important, therefore, for us to understand what drives this. And some of the main drivers are exposure to the virus and vulnerability. So in terms of exposure, I've listed here occupation. Occupation is one of the most important determinants of how you're exposed, and the most at risk are those that have least controlled and are often low paid jobs. So a very good ONS study showed that. Housing is another issue, particularly overcrowding, and again, socially patterned. And then in terms of vulnerability, there has been a lot in the press about comorbidities, particularly striking actually diabetes, rather than only respiratory disease, so cardiovascular disease and diabetes. And we know again that diabetes is particularly prevalent in some of our BAME communities. Now, as you can see, those underlying causes are mostly socially patterned. So we are talking about structural inequalities driving most of the inequalities we see in COVID impact. If you move a slide further, please. Here, what I've tried to do, and I think it's quite interesting, I won't take up all your time. These are ecological studies, so it's not that we have the data for individual people, but we've overlaid. So the red dots are the deaths, and you can clearly see that we have the fat dots in the east of the borough, and then it overlays in who lives there. And so you can see the association with BAME. You can see very, very clearly the association in high-risk occupation. So it is the exposure that drives a lot of the inequality. We've got quite a good association there with diabetes, and that is something we can tackle. And interestingly, and hence the explanation for our east-west divide, we haven't got as much of an association with old age. If you move on, Clarissa, can you move on, please? I won't go into the recommendations of the qualitative research from the BAME review, but I think it is very good reading, and I recommend it. And the next slide, which is our proposed future work program, very much takes into consideration some of the really important insights from the qualitative work. So what we're proposing to do is, obviously, we need to keep an eye on the data. So that is our joint strategic needs assessment. The Health and Wellbeing Board owns it, and we will focus that on COVID. For me, what is quite important is that we also look at the indirect impact of COVID. So what other harm has been done, a lot in the press, for example, mental health impact. So focus both on direct and indirect. And then we want to work with the NHS. They have a really good data set of health service data, so that we can understand a little bit more as well emerging evidence about health-seeking behaviours, how late people made it into hospital with COVID. So a lot more granularity. What for me really important, and I am happy that the Health and Wellbeing Board is overseeing that we want to understand the lived experience. Data can only tell you so much. So we're working on some qualitative action research and engagement with the voluntary sector. So the type of community engagement methodology. We want to focus first on BAME, but obviously age, dementia, learning disabilities are also in groups that we very much want to hear from. And the purpose of all of that is obviously deepening our understanding, but always with a clear focus on action planning. And for me, very, very important, as I said, there's a lot of structural stuff behind that, and we absolutely are committed as the board. But for me, there is something very immediate. We're not yet out of in the woods. There might be more spikes and next wave. So I'm very, very keen that we take all the knowledge that we have now to protect from a potential any further outbreak, and working very closely with our health colleagues on, for example, working with our diabetic patients to make sure that the diabetes is well controlled, using our health checks for some preventative work. So really quite concrete interventions now. Short and medium term, as I said, we have to keep an eye on the adverse health impacts of the COVID response. Mental health is a particularly important one. And then, as I said, medium longer term, we have our health and wellbeing strategy, our local health and care plan, and we want to shape a safe, fair and green recovery for Merton people and Merton as a place. So hopefully that gives you our first sort of attempt to make some sense and take some action following COVID. Thank you.
Thank you, Dagmar. Does anyone have any questions or comments on that particularly, or on the proposed work of the Health and Wellbeing Board in response? James?
Yes, thank you. I think it's a very comprehensive and very informative analysis. Dagmar will be aware that we are pulling together as contemporaneous as possible data within the NHS, and mapping admissions in particular from COVID down to lower super output levels. So that's the smallest possible geographic level. And I think that from what I've seen, I would support everything that Dagmar said. In particular, we are, and it is early data, and it's too early to draw definitive conclusions about this, why this is, but we are seeing quite marked variations within East Merton from area to area in terms of rates of admission, and these need to be really clearly reconciled back to risk factors. I think clearly it is concerning that we have a population that has a high level of vulnerability. I think that is manifested by where Merton sat within the overall level of diagnoses across London. But I think what's good is that we have the data, and I think we have the data to identify some modifiable risk factors relatively early. And I think the work that we've done, particularly on diabetes previously, gives us the ability to make some fairly rapid interventions. So I think that is the from an MHCT perspective, I think that is the brief that we are now working to.
Thank you. Karen?
Could I highlight for action a group that I think it's really important that we don't overlook, and that's children. Although we know that children have not been generally directly affected, thank goodness, from the point of view of illness from COVID, I think there are significant indirect effects on children through a whole host of factors, including being out of education and impacts on family well-being. So I'd just like to make sure that we don't overlook that. And also I wonder about whether we need to have a focus on rehabilitation type services for people who've been seriously ill with COVID, because as we learn more about the condition, I think unfortunately there will be a cohort of people for whom it's a long-term condition with both physical and mental longer-term impacts that will require sort of partnership working. Thank you.
Can I quickly come in on the children, Chair? because Karen, you obviously know I am also a passionate advocate for children, and I'm particularly interested therefore in the lived experience part of the work, to not forget the children, because children and young people, and you will hear a bit later that we are proposing a subgroup of more community representatives overseeing the work, and that we have already a young inspector in mind to contribute to that work.
Thank you. Mohan.
Thank you, Chair. Yes, it was, good to see all that data, which echoes fairly similar to what we're seeing London-wide and nationally as well. And I think the health inequality bit is particularly a concern, and something we kind of need to work together. And certainly as East Merton locality lead, I'd certainly like to drive that. Some of the things which I've picked up is certainly around education and training, some of the enablers to make this happen, in terms of supporting our residents, supporting each other, and how we see patients in the wider system as well as on the system itself. But I think working partnership together and advocacy of actually what we're dealing with will ensure that we build this prehabilitation period for either a wave 2 or for the long-term conditions which may exist going forward. So I certainly welcome that, and I'd certainly want to try and address the health inequalities. Unfortunately, the gap would have widened as a result of COVID, regardless of whether we like it or not. And we need to kind of try and bring that in and acknowledge that, really, because I think there's a real opportunity here. Thank you.
Vassar.
Thanks, Chair. It's also important to remember that citizens of Merton are also the care workers and the healthcare personnel of Merton, and those who are disadvantaged have about lived experience, but it's also the lived experience of knowing that they may fall. The very same people will call upon, and I think we need to recognize that and also support them and also rehabilitate them physically and mentally to be there, to be counted once again at the hour of need.
Thank you. Rob.
Yeah, just thanks very much for that report, Dagmar. It was really interesting to read that, and I suspect the impact of COVID has probably played out in the way in which we might have predicted that it would in terms of the health inequalities that others have mentioned. But I was pleased really to hear you talking about the need to understand the indirect impact of COVID as well. And I think we obviously know that the wider social, the wider determinants of health and the negative impact on health of things like the economy, social isolation, and all of those other factors will intensify over the coming months for those groups who are already vulnerable. So I think the more we can understand about those indirect impacts, the better we can then inform the way in which we align services and make sure that those people get the support that they need, both direct support and preventative support, to ensure that their situation doesn't worsen. So it'd be really interesting to hear more about how that will unfold, and if the voluntary sector can be a part of that, then of course we will be.
Thank you. I don't see any more. Oh, Dave.
Yeah, no, it was just to echo what's been said, but also to one of the things that HealthWatch did was a small survey just to get a snapshot. But actually what we got back was what COVID has really done is just highlighted almost it's just amplified what we kind of generally knew locally already around deprivation, inequality, and all the stuff that's been said. So it might be mindful to actually look back at some of the previous work that's actually happened as well, to not lose sight of that journey. Because I know that we had a BME strategy that was refreshed in 2010, 2013 that worked with all the local organisations. And having looked back over the areas they covered, it was very insightful that most of them, if not all of them, are still relevant to today. and it'd be interesting to see what progress we've made from there to the journey to where we are now, on top of what's going on obviously with COVID-19 and how that's obviously pinpointing that focus. So I think that we could use it as an opportunity to also further progress our journey along that line.
I think that's a really important point. One of the quotes that I picked out from the Public Health England report was that the pandemic didn't create health inequalities, it just exposed and exacerbated them. And I think we know that in Merton probably more than other boroughs, because we have been looking at measures to tackle the East-West divide for a number of years. So absolutely, I'm sure there's an opportunity to revisit previous strategies and look at what has worked and what we might need to look at again. Anyone else want to come in on this? It's something that we will come back to a lot, I'm sure, in the coming months, and the data will continue to emerge. Okay, well, thank you, Dagmar, for that very insightful presentation. I think we are all happy with the direction of travel in terms of the board's work and involvement. So we look forward to seeing the next iteration. Item 6 then is the Merton Care Home Support Plan. And is Hannah going to present that, or is that Dagmar again?
So good evening, Chair. No, that's me. You will have seen the slides that I sent through, Chair, and I'm conscious that our time is limited this evening, and this is such an important subject and very close to people's hearts. So I will set the context, and then following the board, even though our plan of how we've wrapped around support to our care homes in Merton has been published on the Merton website in response to the Minister for Health and Care, we can easily get that sent around with the minutes, so everybody has easy access to that. Just to say, COVID-19 brought unprecedented challenges across the health and care sector, but no more so than the care homes. And I just want to take this opportunity to thank the care home providers across Merton and our colleagues in health for working as one system to ensure the care homes were supported and got the level of support that they needed to keep some of our most vulnerable residents safe. We took a very early approach to this in Merton before it ever came on your screens at home or in your newspapers, because we were concerned about the level of vulnerability across the care home sector. We 37 homes in Merton, and 21 of those are older people. The focus was on older people. However, we took a decision that our learning disability and mental health homes were also vulnerable. So the support that was offered and the enhanced care support programme was actually ramped up to provide care and support across all of the 37 homes. So when we received the request alongside the infection control funding from the Minister for Care, we were very, very clear that we were able to respond fully. That response, we can just go on to slide 3, set out a number of key themes, which you will see on your screen. It also set out our approach to our contribution of the 600 million that was allocated nationally. Merton's allocation was 1.3. And again, it is detailed out in the response letter how that money has been allocated in line with the guidelines of the grant. I'm just now going to hand over to Dagmar, because one of the key indicators that helped us to ensure that we had a grip on this at a very, very early stage in Merton was the data that we were so reliant on from public health colleagues. So I will just hand that over to Dagmar to describe a little bit more to you, and we will ensure the full response to the Minister of State for Care letter that's published on our website is sent out to all of you.
Thank you, Hannah. Clarissa, if you just move one slide further. So very briefly, a bit of key learning. As Hannah said, we were pretty quick to react. And I cannot stress enough how important it was to collaborate with our health colleagues, because what we created was a multidisciplinary, really hands-on response for the care homes that found themselves really quite overwhelmed and then really in the limelight. And one of the most important bits was to actually really tune in and develop a relationship with each and every single care home. And I will show you in a minute, we developed a dashboard and a regular daily telephone conversation with the care homes to tune in, because if you imagine in the conditions for the care home managers and the staff were really tricky. There was the ask to isolate, to cohort patients, and you have elderly patients, they might be confused, they might be demented, you ask them to be swapped, which is frightening. So it was really important, not just top down, say do this and that, but tune in what the real issues were. So I think that worked very well, and I have to say a big thank you to health colleagues, the primary care that did remote clinics and helped in our CLCH community partners with their nursing wraparound, and indeed our colleagues from Public Health England. We had very good, very rapid response to help the care homes. Going forward, I think we're not out of the woods. There are some, I think, really important issues. One is it was a traumatic episode, and we want to understand and have a bit more dialogue and engagement now that the care homes are opening up again. This will be led by our safeguarding board, and obviously there is the issue of sustainability of care homes in the future. And as we said before, we still have to be very, very alert. And COVID isn't gone, and we have to continue to protect our care homes. What I wish in a way, and I think the Health and Wellbeing Board can contribute, is that we've now shown the limelight on an area in health and care that hasn't always had its services valued or properly invested. And I hope that enhanced care in care homes will now be really taken seriously. If you go one slide further, I just show you the snapshot of these are all our care homes. It shows you data again. And one last slide. If you just move further, Clarissa, that gives you the idea of the care homes. So they're all there, they get RAG rated, and we actually call them and we work through, have they got PPE, how much staff have they, the real nitty-gritties. And that's what really gave us the confidence, assurance, and turned it around. Thank you.
Thank you, Hannah and Dagmar. Any questions or comments on that? Well, if I can just echo my thanks to you and your teams, because I know the care homes have been very appreciative of all the support that has been provided, and it really has been an awful lot of work to ensure that they do all have what they need and can operate as safely as possible. So thank you to you and your teams, and thank you to all of our care homes as well. If we move on then to agenda item 7, this is a presentation on the community hub. I don't know whether Simon is going to lead on that. Can't see him anymore.
You're on mute, Simon.
Yes, Chair, I'll do the first slide and then Rob will follow on. And I'll apologise, my Zoom seems very unstable, so if I disappear, I can only apologise. I don't know why it chose this hour to do that. Just as a bit of background to the voluntary sector position, obviously the first point, you know, there's been seismic transformation over this period of the impact on many of the organisations. But on the positive side, from very small to some of the larger organisations, they've been involved very heavily and in very supportive way in the community hub and other activity, which Rob will go on to talk about. Of interest, we did a survey in April of 57 local organisations to get a sort of temperature check on how they were coping at that point. And as you can see from the statistics there, just over half of them had to adjust their services, 40% had to stop completely, and only 5% were really continuing normal service. There was also the impact of financial loss, immediate financial loss for 81% of them. Some weren't sure, and the very worrying 14% were concerned about their longer term survival. Over 50%, 57% were expecting reduced or cancelled service, and as a result that would impact on them financially. And 61% thought MVSC could best help with funding and funding advice, which we have indeed done, and maybe under item 9 I'll give you a bit more update on that. We were both prompt with setting up the community hub, which Rob will talk about, in conjunction with support from CCG and the London Borough Merton team. But we also were very quick in setting up the Merton Giving Fund with coronavirus focus. And we started with an opening fund of £150,000 with contributions from MVSC, Merton Council, Wimbledon Foundation, Clarion Futures, Moat Housing, plus Merton Giving donations that come from businesses and individuals in the borough. Up until week 9, which was the week before last, we'd had 61 applications and we'd awarded just short of £120,000 to 49 organisations. And each week we provide an infographic with the summary average grant, which runs rather consistently around the 2,300 mark. So that's been helpful, and I'll talk a bit later about some of the other work that MVSC and the voluntary sector has done. I think looking ahead at the future, as we know that the recovery sort of stage will require significant adjustment. Some of that may be helpful actually in some of the services, but we know the new normal is a little bit unknown and when it will happen. Longer term funding is going to be a major challenge. The funding that has been around has been incredibly oversubscribed, and we know that there'll be financial pressures sort of in every walk of life going forward. So that is a concern for small organisations. But I sort of finish with what's been a huge positive of the activity, both within the voluntary sector and with CCG and London Borough Merton, is how well partnership and collaboration has succeeded, and an attitude that has been just wholly positive. And I just think that's an opportunity for the sector as we go forward. So I hope that helps as a bit of a backdrop from what we've seen, and pass over to Rob.
Thanks for that, Simon. And I think, as Simon said, there are many examples of collaboration that we've seen in response to COVID across the borough. But the one in which we want to highlight this evening is the Merton Community Response Hub. And I'm sure board members will know that this was established sort of from the middle of March, really, as the writing was on the wall in terms of what would happen for the borough and its residents. And it's been the sort of truest collaboration and partnership, as Simon referred to there, between the voluntary sector and colleagues in the London Borough, Merton, and across health. But I suppose, in short, the delivery model of it was the rapid mobilisation of voluntary sector support. And I think it takes a crisis sometimes to make you think, what you're really there to do. But I can honestly say, across the board, from all of the partners, there was absolutely no hesitation at all. The answer was just yes. What is it that we need to do? And I think for me, it really is an indication of the potential impact and the promise of that Health and Care Together programme. Just coming on to the impact of the hub itself, these statistics are from the 23rd of March, when the hub began, to just the end of May, so 10 weeks, covering that sort of primary intense lockdown period. And just to give you an indication of the scale, the hub was set up to be a centralised point, and primarily to support people with essential needs that they may not be able to have done because they were isolated or their usual support networks were diminishing. So over 2,000 calls from residents and agencies into the hub. And initially we saw a huge influx of people offering help. So 8%, it doesn't sound like that much actually, but hundreds of people within the community were contacting the hub and being processed to mobilise to actually provide that practical support that was required. And I think that is something that we need to capture moving forwards. But 92% of those calls were from people either seeking help for themselves, seeking help for friends, neighbours, relatives. And in fact, we also saw a lot of agencies referring into the hub for that very focused practical support. And of those 2,000 calls, 1,454 resulted in onward referrals to 6 local charities who are listed there. And those referrals were distributed on a geographical basis primarily, and each organisation with a base in a particular geographical area within the borough referrals, followed up with the clients who were seeking that support and made sure that that support was in place as rapidly as possible. And we're talking about things like shopping, keeping in touch calls to support people's emotional well-being, and other very practical things that just were absolutely essential in that period. And the distribution of those referrals were 33% to Age UK Merton, 12% to Commonside Development Trust, 12% to Friends in St Helier, 8% to Merton and Morden Guild, and 35% to Wimbledon Guild. And you can see there that the larger organisations took a higher ratio of those referrals, but it's important to say that what we were able to pull out from that partnership was that local specialised knowledge in a locality, and that was done primarily to be able to match local volunteers to local people needing support. And this, for me, is perhaps potentially interesting statistic, is that across those 5 organisations, 1,800 in the borough, existing customers, were also receiving support in addition from those 5 organisations. And if you extrapolate out how many voluntary sector organisations we got, you can see the scale of reach and the scale of support that was being provided by the voluntary sector at that time. And one thing that came up as the lockdown unfolded was that people were struggling to access that they needed. And so the social prescribing team, who are based with MVSC, really took the lead on that. And so 16% of all the referrals needed help to access their medication. And actually, those social prescribers were then able to link those residents back into the health system to make sure that they got the prescriptions that they needed. And I think we all know that social prescribing quite often works from health, connecting people to the community, but actually in this case, which was a really nice thing to be able to provide for residents at that time. we began to analyse the people who were contacting the hub as well, and throughout that period, you can see that a significant number of people, 43% of those referrals were for people aged over 70. And as indicated in Dagmar's presentation, the need, I suppose, was more prevalent in the east, with 62% of the referrals coming from the east of the borough. However, that said, it was a truly borough-wide, or it has been a truly borough-wide initiative, and I think we know that, you know, in the west of the borough, you have a potentially older population, possibly living more alone, and their normal networks may have disappeared during this time, which is why they needed that support too. So, in some ways, that community response was as broad as you could imagine across the borough. And I think the primary thing that we encountered that people were needing help with, certainly to begin with, was access to food. And it seems unusual, I think, perhaps for a civilized society like ours to have an issue of this nature. But 519 of the people who contacted the hub needed an emergency food parcel because they didn't have food available for them. And I think a number of initiatives cropped up at the time and have developed since then to provide a much greater significant coordinated effort to ensure that borough residents got the food that they needed. And just coming on to the future, I think over the last 3 weeks of the hub, we've seen the number of calls into the hub stabilizing somewhat, but we know that there remains uncertainty for the future. And I think what the partners who've been handling those referrals have really got to grips with over that time is that we've been able to successfully meet the immediate needs of residents, but as you encounter and come into contact and ask further questions, you then discover that there are a range of complex needs underneath that. And so the future of the hub is secure for the next 3 months, and will be taken forward by the voluntary sector, handling the calls directly themselves. And I think it's right that we, at this point, pay tribute to the London Borough of Merton staff, who were the call handlers who were deployed from elsewhere during this time and had to learn very, very quickly how to ask the right questions to people who needed support. And I think the libraries team need a lot of credit for what they were able to do. They've been absolutely fantastic. But moving forwards, the Community Response Hub will be serviced by the voluntary sector directly. And the plan is a more triage mechanism at the point of contact, so that we can still provide that immediate rapid response for residents as we provide more ongoing, longer term support to ensure that residents get the support that they need in a more sustainable way. And I think as we move that model forwards, we'll be very happy to come back to the board and report back on the sorts of needs that we're encountering at that community level and the impact of what the Response Hub has been as we move forwards. Thank you, Chair.
Thank you very much. Are there any comments or questions on the voluntary response? Mohan.
I just want to commend the hub. I think it's been fantastic during COVID. A lot of boroughs are very envious of our hub and asking lots of questions. How do you do it? How do you set it up? And I said, well, we've got it. And actually, on a serious note, I think it's shown how good the integration could be, using social prescribers to deliver prescriptions. And actually, that's just the start of it. I think there's some real other opportunities we can add to that sort of going forward. And certainly, if there is a second wave, we're nicely embedded to kind of take that forward. So I'm really pleased that it's going to be sticking around for another 3 months as a minimum. And I think it's a really strong mark for Merton. Well done.
James.
Yeah, I mean, I think I'd echo everything. I think it's been a real strength. I think it's built on the strength and depth that we've developed through partnership with the voluntary sector and social prescribing over the last few years. I think for me, this is a bit of a paradigm shift, because it working with the voluntary sector has always been something that we've known that we should do as CCGs, and CCGs have done it to a less or greater extent. Actually, for me, if we are doing our job properly in terms of commissioning for health inequalities now, and tackling some of the issues that COVID has thrown up, and making sure that we are resilient for a future second wave, there are places that the voluntary sector can reach that we as a statutory body simply can't. So actually that partnership is now front and centre of that, and so I think it's a really strong base to be working on in Merton, where we've managed to mobilise in this way, and it's building on the work that we've done for a number of years, and as Mohan says, there are other boroughs that are quite envious of it.
Any other comments? No? Well, can I add to the commending the work that's been done, and thank particularly Simon and Rob, but everyone else in the voluntary sector. I think that the versatility and the responsiveness of the sector was phenomenal in getting the community hub up and running so quickly. And ultimately, we would not have been able to support as many people across the borough without that, because the statutory services just would not have been able to cope. So it has been an incredible response, and thank you, and to everyone who's volunteered for your organisations as well in supporting all those people, and I hope you will pass on our thanks to them. If we move then to item 8, which is it says test, track and trace, but it might also be test, track and isolate. I'm not exactly sure what the title is now, but Dagmar can maybe enlighten us.
Yeah, so hello, this item is a brief verbal update only, so that you're aware about in what we are doing around supporting the NHS testing and contact tracing service. You probably have all heard in the national press that the contact tracing is up and running now, and what is really important is to frame it as one of our tools to cope with clusters of COVID and to prevent outbreaks, and that we really have to engage in terms of communicating and understanding in our communities, so that when people develop symptoms, that they get tested and that they engage with contact tracing. And if you think back to some of the recommendations from the Qualitative Public Health England report, one of the big insights was that during in command and control, during the peak of the epidemic, the comms messages were raining down, but they were frankly really quite white and middle class, and so they did not really land equally and with the consequences. So we're very keen this time round in that we engage and understand and make the messages or translate almost the messages and work with the voluntary sector. And the local authorities have explicit a role to play now to provide a wraparound service to the national NHS service, and the Health and Wellbeing Board is going to play a really important role. And that's why I'm going to raise it here, because I want you as well, when you are out there, to try to explain and frame that the contact tracing is a protection tool. We have heard a lot about our particularly vulnerable communities, and if we don't get the awareness raising right, we will replicate in that we will not have the testing and the uptake in the most vulnerable communities. So what we are proposing is that we will have a subgroup of the Health and Wellbeing Board with particularly community representatives that mirror the diversity of our community, to oversee the implementation of the outbreak plan, to actually check out that the messages have landed. And ever frugal, we want this oversight group to double up and also provide the oversight for our COVID impact work. And so that's the proposal. And Tobin, I don't know whether you wanted to just add a few more words.
Well, I suppose only to emphasise the point that it is really important that we get people on that subgroup who do have the links into the community, because part of the role of that subgroup will be to disseminate the message and emphasize the importance of getting tested and isolating if you are tested. So we will be looking at the composition of that in the next week or so, and we will circulate by email some thoughts. And then the idea would be that the subgroup would meet more regularly than the Health and Wellbeing Board to provide, certainly in the immediate future, the function to oversee the plan, but reporting back up into the full Health and Wellbeing Board. So it will become a standing item on our agenda, I suspect, for the foreseeable future. Any questions on any of that for Dagmar before we move on? No? Okay, so on item 9, the idea really is just to provide a brief update, particularly for those who haven't said much to date, about some of the work they've been doing, and maybe more looking forward about what's to come. So I'll call people and then we'll take questions at the end, if that's okay. So if we start with the NHS, I don't know if James or Vasa, you want to kick off?
I'll hand over to Vasa.
Vasa.
Tobin, I do know that Vasa's having trouble with his technology.
Okay.
Because you're hearing, I think.
Karen, sorry to put you on the spot, would you be prepared to just say something about our primary care response?
Yeah, okay. So, I'm not muted, am I? No, okay. I've got a video on. Sorry, people. Okay, so primary care, we've really tried to embrace the triage first approach to patients accessing our services. So we've also rapidly deployed and expanded some of the digital initiatives that we were already working on. So that is mainly ensuring that patients are able to contact us by telephone, online, and also all practices now are offering video consultations. We've also rolled out remote working, which has really been important in supporting our workforce resilience. And I'm pleased to say that we've not had any practices, even during the peak of COVID, that have not been able to offer services to their patients. We've also set up some COVID-specific services. We've had 2 hubs running where patients who have suspected COVID or proven COVID, who need a face-to-face assessment, have been able to be seen by a GP in a safe environment. And we've also augmented the community multidisciplinary home visiting service by having a GP allocated to that 7 days a week. So as the number of cases is thankfully falling now, we're revising those services, looking at them, looking at the learning from them so that we can plan for any future waves that may occur. But we're also now really strongly switching our focus on to resetting primary care and restarting some of the services that have been paused. So focusing on patients with long-term conditions, people who may have been adversely affected during COVID, restarting things like screening and immunisations. So that's it in a very quick nutshell.
Thank you. James, did you want to add anything more on the NHS?
I mean, I think the only thing to say is that all of our structures at the moment are ways of working really focused on recovery. So there is a South West London Recovery Board that is overseeing a huge amount of work that is happening both at borough level in terms of primary care, community hubs, responding to some of the health inequalities issues. But on a wider South West London footprint, we're doing a huge amount of work around restarting elective services, for example, but doing it in a way that is compliant with infection prevention and control guidance. So looking at how we segregate services, make sure we've got pathways that are suitable for people to come in for elective operations. I don't want to go into the detail of it all now. It may be that actually we bring it back to a future Health and Wellbeing Board, but just to say that as well as the borough level work, there's an awful lot of work in terms of recovering NHS services in a way that works with the fact that we still have COVID within the healthcare system, but also make sure that we've got appropriate service provision for people with non-COVID needs.
And I know there's a real push to encourage people who are presenting with conditions not to put off seeking help where they need it.
Yeah, that's absolutely right. So we've done a comms campaign in South West London called The NHS is Here For You. And that has encouraged people with particularly signs and symptoms that could be cancer or with symptoms, for example, of a heart attack or stroke, to make sure that they're presenting. I mean, I think what I can say is that particularly with the cancer referral rates, that they are going back up now quite rapidly, and they're going up faster in South West London than they are in other areas. So I think that there is some success to that campaign, but those rates are still not back where they need to be, and we have seen some impacts from late presentation as well. So I think it's worth reinforcing those messages when we can.
Thank you. Simon and Rob on the voluntary sector.
Thank you, Chair. Yeah, I'll just be very brief. We're really focusing now, from MBSC and collectively within the voluntary sector on how services might be re-established. Obviously, the sort of recovery stage work. From an MVSC point of view, we're doing a lot of work with organisations, including quite a focus on BAME organisations around both recovery and sustainability. And for example, during May, we did 23 plans with organisations on how we might support them through that stage. Also, the financial situation and the challenges doesn't go away. We did support 19 organisations in May to achieve 104,000 of funding, some of that from Merton Giving Fund, but some from other funding pots such as the London Community Fund. So we're working hard to make sure that particularly the smaller organisations are getting the support that they need. We're also, Rob mentioned that we've had a huge number of volunteers, and I think most of you will be aware that the mutual aid group in Merton has had around 2,800 volunteers at its peak, although some are falling away now. But from a sort of borough-wide volunteering position, we want to make sure that we maximise the use of volunteers to support the sector and to learn some of the lessons from mutual aid group and Wimbledon Dons, for example, who mobilise people really quickly and successfully, and have done a marvellous job of sort of adding firepower to the stuff that the sort of Big Five, Big Six supported around the community hub. And we're in regular dialogue with particularly mutual aid group about how we learn from that. And I know Dr. Mohan has put some of their people to good use with the SATS testing pilot that he did. For the future, I think it is about more collaboration and particularly with some of the smaller organisations, connecting them better with other organisations so there's mutual support. And certainly from a MBSC viewpoint, we will continue to do the sort of health checks of organisations to make sure that whatever help they can get, whether it's directly from us or from other funding routes or other support, that will go on. So a lot of work still to do, but keeping us very busy and happily so. Thank you, Chair.
Rob, did you want to add anything?
I don't have a great deal to add, actually. Just to reiterate that a lot of the members of the Health and Social Care Forum, which I chair, are looking at their recovery planning. And I think we know that for a number of those organisations, services have ceased in their normal form or certainly retracted greatly. So I think as we move forwards, we'll need to do some analysis about what those gaps are, particularly in those preventative services that help to maintain people's health and well-being, so that we can make sure that they continue in some form and the people who access them are supported on a continued basis. And I think the one thing, in the interest of brevity, I'll shut up shortly, the one thing I'd like to flag, I think, is that we need to do a bit of thinking around it across the system is the issue of digital exclusion. And I think for me, kind of sort of working within kind of more older people's services, people who struggle to access services in normal circumstances and being excluded for various different reasons will continue to be excluded, and potentially more excluded, if services move to a more digital by default model. So I think some work needs to be done to ensure that those barriers to access to digital support are addressed across the borough. And I know there are conversations and work being done to do that. So it's just one thing I wanted to raise with the board, just to flag it, really. But I don't have anything else to add beyond that.
Thank you. One of the benefits of these Zoom calls is you see everyone, and I saw a lot of nodding when you were talking about digital exclusion. So I certainly think that's something that we will want to revisit. Dave, do you want to give us an update on Healthwatch?
Yeah, in the beginning, during March, Healthwatch Merton, we temporarily paused the majority of our activity and directed whatever resources in actually supporting, as you've heard already, the setting up and development establishment of the COVID-19 community hub, particularly using some of my expertise around the IT system and also the processes and management of calls before we actually step back after the initial first 3 weeks to continue with our own work within Healthwatch. We also committed some of our resources to supporting volunteer brokerage of over 500 volunteer offers and directed people to key organisations locally supporting vulnerable and isolated residents. We've recently carried out some virtual outreach, the last being done with Merton Centre for Independent Living in collaboration with Aman, the Patient and Public Engagement Manager from NHS South West London CCG. And next confirmed virtual outreach session is on the 7th of July, and that's with Merton MenCap Adults First, Kids First. Continues to do our regular bi-weekly meetings with a man again from CCG. We've been supporting the work of the young inspectors, I think as Dagmar mentioned earlier. Also supported some of the stuff from One New Merton, and in terms of information sharing, we've maintained our website and Twitter accounts sharing and promoting obviously the ever-changing COVID-19 restrictions. We've done several, I think up to 4 e-bulletins since March, focusing on stuff that local people can do during COVID-19 and information sharing from when GP surgeries and what their capacity and availability is to activities for parents to do with children. We continue to do like regular link up and check in contact with some of our local organisations. We recently did actually just finished doing a quick snapshot survey just to get some top line headline stuff on the impact of COVID and access to health services. A thing that reflects something that Karen mentioned, which was about primary care altering the way it was delivering its services, was that out of 63 responses, 79% still actually were accessing their GP practice for non-COVID-19 related issues. So it's just to show that actually the primary care was still delivering some of its core work. And a lot of that was done through phone, video and face-to-face. And then just to finish, it would be just directed at Dagmar, is just talk to us about exploring how we can help and support some of the BME work that you mentioned that you're looking to be carrying out.
Thank you very much, Dave. Brian, did you want to add anything?
Thank you. For those who don't know me, I'm Brian Dillon. I'm chair of Healthwatch Merton. Dave's given a good rundown there. It's been very difficult to keep Healthwatch going. It's done a good job. We've had no physical outreach, obviously. It's been very difficult. But I'm very pleased with what we've done. I'm speaking really as not only as Healthwatch chair, but as treasurer of MBSC. And as an accountant, God help me. And my concern is for Hannah for the prognosis for her budgets on the care side and for all the care homes. I've read the report, and of the response. And I'm also concerned about the inevitable reliance on the community sector, the voluntary sector, to reach out to the more vulnerable. And it's going to get worse because the economy is going to decline. There'll be more people who are losing their jobs. There'll be all sorts of new demand, and I'm worried where the budget's going to come from. It's not going to come from the borough, and they won't have the budget. So it's just an obvious thing. It's the elephant in the room always, that resources are going to be declining when we actually need to draw on more resources. I've said nothing new, Tobin, but that's where I'm at.
I can always rely on you to cheer us all up, can't I, Brian?
I'd like to give you a good sign off there, Tobin.
Can we go to Rachel Wardell and Councillor Stringer to talk about children's services?
Thank you, Tobin. So I'd like to concur with everyone who has mentioned children already and reminded us that although from the point of view of the impact of the disease itself, this is not something, mercifully, that tends to affect children seriously or in great numbers, but this is nevertheless a public health emergency for our children. And the reason for that is because the impact of the lockdown and the measures that we're taking to protect the wider community are impacting significantly on every child in the borough. What we've been doing as a borough collectively, so the Children's Schools and Families Department in the council, but also our partners across sectors and most particularly our schools, is ensuring that we support all of our children. Schools, although notionally they have been closed since the 23rd of March, have in fact been open throughout this period to children of critical workers and to vulnerable children, and that has included being open over the Easter holidays and for many of our schools over what would have been the end of May half term. So there's been some really sterling work done there. Since the beginning of June, schools have opened more widely to priority year groups. In primary, that has been nursery, reception, year 1 and year 6. And with effect of from the 15th of June, secondaries have also opened more widely to years 10 and 12, which are priority year groups because they are due to have exams in the next academic year. And we have seen a steady increase in the number of children in our schools, both in those priority year groups and among children of critical workers and vulnerable children. And yesterday we had more than 4,500 children attending school in Merton, which is a testament to the great work that the schools have done to be able to open more widely and safely. And just as a reminder, throughout this period, they have also been providing educational resources to children at home. So children who are still at home have been continuing to learn at home, and they have been working with us to support children who we've identified as children who we ought to be concerned about. So those children, we might not have been able to get them back into school even though they're vulnerable, but we've been working with schools to assure ourselves that they are safe at home with their families. I'll move on to vulnerable children and the social care work that's being undertaken. So as you can imagine, one of the principal ways that we assure ourselves that a child is safe is by seeing that child. And one of the challenges for us during this period has been that a lot of our work has become virtual. So wherever it is safe to do so. So we are spending much more time, all my social workers and other colleagues, interacting virtually with children and their families, using all of the various apps, including Zoom as we're using now, in order to make contact. But of course, from time to time, it's absolutely imperative that a child is seen in person, seen alone, seen in their home environment. And so throughout this period, we have had social workers and others undertaking visits, seeing children to assure themselves that those children are safe. We have been supervising contact between separated families, where supervised contact is required by the courts. I have been undertaking that virtually as well, and making arrangements to ensure family time for children in our care with their birth families. And again, a lot of that these days increasingly done virtually. We had arrangements in place to shrink our social work teams if we needed to, if they were significantly affected by coronavirus themselves, but I'm happy to say that we never saw a reduction of more than approximately 20% of our staffing, and we've been over 80% staffed for a very long time now as part of this. So we've been able to continue with our work very effectively. We saw at the start of the outbreak a reduction in referrals, and that was largely because children weren't being seen, and therefore people weren't in a position to raise concerns. But we have been mightily concerned that there are things taking place behind closed doors where families are under increased pressure that may be exerting increased pressure on children. So we are conscious that we have significantly higher numbers of households now requiring universal credit. We know more families have become eligible for free school meals. That tells us that families are facing financial hardship, and that exerts pressure on the family dynamic. We know from experience in other countries that domestic abuse increases during lockdown, and although we didn't see those reports initially, we have started to see increases in domestic abuse incidents and offences over this period as well. And what we're anticipating as children return to school and become more visible in other public settings is that our referrals will increase and the severity of the concerns that we're dealing with will increase. So we often talk about the possibility of a second peak of the coronavirus itself, but in children's schools and families, we talk about the children's peak. And we think that the peak of impact on our part of the system will happen later, after the health impact, as we see increasing numbers of safeguarding referrals. The one other thing to mention before I hand over to someone else is for children's health itself, both physical and mental health. There is also an impact of this crisis. So we have seen throughout a reduced presentation of children in hospitals for other ailments and hospitalizations and across London, sadly, deaths from common childhood illnesses as a result of delayed presentation. So one of the things that we worked hard on, and in collaboration with schools, was to get the message across to parents that it's really important to bring your children in for healthcare. We're also conscious that although for many children, they have really enjoyed the lockdown, actually, more family time and sometimes not being at school has been a bonus for them. For lots of children, it's impacted significantly on their mental health. And Merton is doing great work around young people's mental health, but we're going to need to call on that significantly in the coming weeks and months. I think I'll stop there.
Thank you. It's a very comprehensive update set to a nice bit of birdsong in the background. Councillor Stringer, did you want to add anything?
Just to quickly add in, but yeah, Rachel's team's work has been tremendous, and the work of schools and partners across the borough has been really inspirational. And I was just going to reiterate that point she made at the end about I certainly, as a Merton parent myself, have appreciated the communications that I've got from the health community, which has gone through schools, to updates from, for example, the school nursing team and the kind of directions that Rachel was giving. I think that's been really well received, and we should make sure that we continue to do that.
Thank you. And one of the things the board's focused on over the past year or so is healthy place, and we're seeing a lot of demand for bikes and perhaps more active travel. So I wonder if Chris Lee wanted to say something on that.
Certainly, thanks, Chair. I'll be brief. And the pandemic has had a significant impact on our ability to provide and promote healthy places. I'm pleased to say that all the services across environment and regeneration departments have been delivered, including street cleaning, waste collection and so on. The one exception is around our leisure centres, which, like all leisure centres across the country, have been closed since March 23rd. With the council's support to GLL, our leisure operator, we're anticipating that they'll move into recovery now from the 6th of July, and their doors will be open with a limited offer. So residents should be able to access the services they previously had. Parks and green spaces have remained open and very well used, but we have faced restrictions over their use. Social distancing has prevented the normal sports and leisure use, and we have had to engage a contractor to assist the authority and the police in ensuring that social distancing was followed. That means that some of the sports that we would normally have aren't being played in our parks and open spaces, but we expect that to recover over the next few weeks and months. Footways and public spaces have in some parts become more congested, and residents have been anxious using them alongside others. And in reopening the high street, our environmental health teams have had to put in a lot of effort to ensure that high streets, town centres and so on can open safely. So a lot of work by licensing and trading standards. One of the silver linings of the pandemic has been a significant reduction in car use and a consequential improvement in air quality, and also noise pollution and road safety. Although we have seen some increase in speeding, but so far no significant impact in terms of road accidents or incidents. And one of the consequences of the lockdown has been a significant reduction in public transport capacity and the public's willingness to use public transport. We've seen a very significant increase in cycling and walking, though we've yet to see detailed empirical data. It's quite clear that more people are engaging in active travel. I know this because I've tried to get hold of some inner tubes from Evans and they've run out. So there's more people riding bikes and getting punctures, unfortunately. So one of the things we're seeking to harness is trying to look at how we can build that transport change, that behavioural change into the way the borough moves. And we're actively planning and investing in emergency transport measures that seek to respond to the new environment and to lock those in. That includes temporary cycle lanes, wider temporary pavements, and also school streets and low traffic neighbourhoods. One of the things that will hamper our ambition is not the absence of ideas or ambition, but the finance that's available, because the funding that was previously provided by Transport for London, around £1.5 million allocated for this year, has been halted for all London boroughs. And the new emergency transport funding that's being made available by Transport for London and the Department for Transport is on a bidding basis. And it's unclear how much we'll be able to access, but we're putting together significant bids, both in the first 6 months of this year and for the next 6 months when that becomes available, to try and lock in some of those active travel changes that we're seeing in the public and the behaviour. And just one final point, Chair, one of the things we're keeping an eye on is that the DFT want to bring forward a pilot across the country where boroughs are interested in hired electric scooters. This is a green travel initiative, but one of the things that we'll be very interested in, we've put our hand up to be one of the pilots in Merton, it will be the impact in terms of road accidents and concern and anxiety about the public when these hired scooters become available, and we'll be looking to ensure that those can be used safely and conveniently by the public in the borough. And we expect to see those probably as early as August or September this year. Thank you, Chair.
Thank you. I think that's a really important update, and it's worth saying that before the pandemic, Dagmar and I had done quite a lot of thinking about how we bring together issues around climate change and public health, because there are a lot of dual benefits when it comes to things like active travel. And the Council's Climate Action Plan is due to be considered by Cabinet next month, and I hope when time allows, it might be something we do bring back to the Health and Wellbeing Board to talk about the overlap between a number of these measures, because I do think there is often benefit in more than one area for some of these things. Hannah, is there anything further you wanted to say on adult social care?
Just 2 points really, Chair. We talked a lot about the care homes, and of course our focus continues on the care homes. But I just wanted to mention, obviously, a number of our vulnerable clients that has remained at home, and our essential services that's provided into people's homes. So 2 groups really I wanted to just opportunity to mention. One is our home care providers, and how incredible they have worked across this borough with us under sometimes very challenging times at those early weeks in relation to access to PPE and testing and all of the changing guidance across the system. But also our unpaid carers. We've had a number of family members that has taken over the role, And that was really done to ensure they were protecting their loved ones and keeping them as safe as possible in their own environment. And again, it's also our day centre users who families, had to look after them without access to daycare. And even though we've creatively done a lot of things through Zoom, it is, a credit to those carers that kept everything going for us and our home care providers by going into people's homes. So our focus continues on those frontline services. One other group I wanted to mention, Chair, just very briefly, is our work with our rough sleepers community. So we've housed and accommodated 52 rough sleepers in Merton. That's quite high for Merton. As you're aware, there's now a task force led by Dame Louise Casey, and we've been working on our plans of what happens to those people once lockdown eases. And again, I just want to reiterate, it's not about accommodating people and putting roofs over their head. It's also the wraparound support that we have worked with our health colleagues and voluntary organisations and our outreach services around health, access to good mental health care, drug and alcohol services, so a whole wraparound plan. I'll leave it there, Chair. Thank you.
Thank you very much. And I'd certainly echo your comments about the carers. And I know that I think we were due to bring the carers strategy to the Health and Wellbeing Board that we had to cancel in March, unfortunately, but hopefully we can bring that back because I know a lot of work has been done on that in tandem with the carers. Dagmar, final word to you.
I don't have anything to add.
Unusual, but I'll take it.
I have already had a lot of airtime, so I'm conscious of the time, so I will spare you anymore.
Thank you. Well, I think that was a really useful update across all partners and an overview of some of the incredible work that has gone on. So thank you again to everyone who's been involved. Were there any comments or questions coming out of that? Una.
Well, I just wanted to say thank you, and please pass on our thanks really on behalf of all councillors, because I just know how everybody feels in terms of the huge amount that everyone's done right across the patch. And I just think wherever I go, I'm really trying to thank the key workers, the health workers, and whoever I come across, because I think overall, I actually do think Merton has done a pretty good job. I guess there is one area, and Hannah just touched on it, and it is close to my heart because I do have a carer in my family who's going out daily and helping as a carer for one of our providers and locally to support care. I mean, in homes. He's just gone out again now, and it is the fact of testing within domiciliary care. And it is something which is really close to my heart. And hearing Dagmar on the importance of testing and so on. I mean, this is really key because they are going out across the patch, visiting people right across. And it is, to me, quite scary that this is an area that I wouldn't say forgotten, that's wrong. Obviously, everyone's, focused on all that can be achieved. But I'm certainly raising it wherever I can, and I think given that we're trying to make sure that we have a full test, trace, and then isolate, project going forward, and given that none of us want to see, increased peaks and so on, that is an area that seems to be just not brilliantly tied in yet. So anyway, that's my bit, but. Yeah, otherwise I think everyone's doing all they can, and it's great to see that. It really is. I'm doing my little bit as a volunteer NHS responder as well whenever I can. It was interesting because we've seen much more of I've seen much more of an increase actually, rather than a decrease in recent weeks of that area as well. So but anyway, yeah, thank you, and I hope everyone stays safe and well. Thank you.
Thank you. I know Hannah spends an awful lot of time on calls about testing. I don't know if you want to say anything on that particular point, Hannah.
So I will, Chair. Just to be clear, I mean, testing has challenged all of us, if I'm being honest. I represent the London Borough DASs on the London Oversight Group, Councillor Moulton, and this is something we are pushing for very, very strongly. There's two aspects to this. First of all, any care worker, domiciliary care worker or care home worker that is showing symptoms obviously can access testing. But of course, the challenge we've got is people without symptoms that work on that front line, including care home workers around retesting. And I'm afraid at the moment, we still haven't got a national strategy piece or direction from SAGE around how useful testing of non-symptomatic workers is, or retesting of care homes, because of course, we've been testing care home residents. Now, do we go out and test them again in 2 weeks, 3 weeks, or a month? And this is some of the challenges on the national testing programme. But I want you to be assured there is a very strong voice, not just from Merton, from all London boroughs, because I think we've all recognised clearly that when C-19 hit, the focus, rightly so at that time, was on acute hospitals and intensive care beds. And I think we've all learned very, very quickly that without the system, without those providers of care homes, without those home care providers, the system wouldn't have been able to stand up to keep people safely at home and people safely in their home in a care home. This isn't about beds or care packages. It's about the fantastic work that those amazing staff have done, and all of the challenges, not just with testing, but the national lack of PPE to begin with, and they kept persevering. So you can be assured a very strong voice on that one, Councillor Moulton.
I do keep raising it myself whenever I see people. Thank you.
Thank you very much. So the final item then was just an item to note the analysis. Dagmar, did you want to say anything on this?
Very, very briefly, because I think at around 8 o'clock you probably have enough. It is a duty of the Health and Wellbeing Board to commission a pharmaceutical needs assessment. It was one of the slight oddities that we inherited. And this is the duty is to refresh every 3 years. So we would be due to have another pharmaceutical needs assessment, but it was sensibly decided to postpone our duty until after COVID. And so not yet. We will in due course present you with the findings.
Thank you. And just to be clear, that's not us postponing our duty. The government has postponed the requirement. Okay. Well, I'm sure we can note that. I apologise that I've failed to keep it to an hour, but I do think it was a really good discussion and a good opportunity to get an update from all partners, and I hope everyone has found it as useful as I have. So thank you all for everything that you are doing, and I look forward to meeting again in September. Thank you.
Thank you. Bye-bye.
Thank you.
Thank you.